Hello, my name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village, and this is a continuing series on back care and maintenance. What I'd like to talk about today is ergonomics, particularly with sitting, as well as proper measurement for an appropriate chair for yourself. These are very general guidelines and not meant to be a one-all fit-all source for finding a chair, but they're typically standard recommendations for chair height, chair appropriateness, and reducing back pain from having proper support. So first, I'd like to talk about the back, particularly the lower part of the back, and then move on to talking about the chair. So hopefully you can see this picture here. These images I've just borrowed from Google. So you have your spine. This is a view of the spine, and the lower part of the spine is called the sacrum. These are a couple of fused bones that help provide stability. They also serve as an interaction between the spine and the hips and the pelvis. Particularly the sacrum, there's a joint. Sacrum is this sort of oval, triangular shaped group of bones here, and it has an interaction with the top bone of the pelvis, the ilium, and that is called the sacroiliac joint. There's two sacroiliac joints, one on either side, and these are important because they help provide stability. They help provide for muscular attachments, as well as transmission of forces through the body. This sacroiliac area is very important. What can happen a lot, though, is by stressing and straining these joints and farther up the chain, stressing and straining the low back muscles and the discs and the actual bones, you can contribute to having an injury or having a pain response when sitting, particularly for sitting for too long. So this is just a general overview of the anatomy. Again, you've got your spine, which is made of different stacked vertebrae. You've got your sacrum, which is a continuation of the vertebra. They're just, these vertebrae are fused together. And then you've got your ilium, which is the big round bone on top of the pelvis. You can feel this if you poke your side and you feel the bony area, you're poking the top of the ilium and the muscular attachments. So keeping that in mind, we'll move on to the next topic, which is measurements. So the reason I'm including this, and it's easier to talk about measurements with a wheelchair, but they're still applicable to any chair. Something that I find a lot treating my patients, particularly when I go into their apartments and see what chairs they have, do a general ergonomic assessment, is sometimes the chairs are not right. Now, it may be a really expensive chair, and that's sort of an excuse I get a lot. Well, this chair costs $600. Well, just because it costs $600 doesn't mean it's an appropriate chair for you. Manufacturers don't always have considerations of the individual person. They're just trying to develop a chair that looks good or is padded or comfortable, but even though it's an expensive chair, it may not be the exact shape or size to fit your appropriate body. So we'll talk a little bit about it. It's easier to talk about in a wheelchair, but the measurements still apply. So hopefully you can see my cursor here on the screen. So we'll talk about this person on the left-hand side. So when you're talking about proper sitting position, you want your hips all the way back in the chair as much as possible, so that your spine is touching, the back of your buttocks is touching, and your thighs are firmly on the chair as far back as possible. You want a little bit of space in between the in between the inside of your knee, so meaning the very, very back of your knee, like the fold of your knee, and the chair. You really don't want it to be, now if it's a soft chair, that's a different story. It can be a little bit touching, but you really want a little bit of space in between the the end of the chair, the farthest seat depth that the chair has, versus the back surface of your knee. Approximately 2 inches is a good measurement, if you were measuring, or 2 or 3 fingers. So if you're sitting and you're looking for a chair, sit with your hips all the way back against the chair, your butt all the way against the back, and then place a couple fingers between the back fold of your knee and the chair. You should have a little bit of a gap for an appropriate chair. Now, if it's a soft chair, maybe a little bit of a difference, because you may be able to get away with a little bit closer. The reasoning for not having so much pressure against the back of your knees is in that you don't want a lot of pressure. You don't want to compromise any nerve structures or blood vessels or anything of that nature that may contribute to pain and swelling and other issues lower down. So from the floor, again, this person is not touching the floor because they're simulating wheelchair leg rest, but you want to talk about the 90-90 rule. So think about a right angle that where the femur and the thigh, the long bone, is perpendicular to the tibia, which is the shaft of the shin. There should be a right angle here. I'm trying to draw a right angle with my cursor. And your feet should be flat on the floor. Feet flat, right angle. That's a general good rule of thumb. As far as armrest height, you want your arms to be relaxed. You want your shoulders to be relaxed. And you want your arms to be approximately touching the armrest without hiking your shoulders or without drooping a lot. If your arms are drooping a lot, you're probably going to shift side to side eventually just for comfort. The seat back should be firm. Again, the seat depth is the really important part, and I'll get to that in a minute. But the seat back should be supportive. It shouldn't be too soft. A little bit soft is okay, but it shouldn't be too soft to where your back is conforming to the surface. So think about the 90-90 rule, where you've got a 90-degree angle here, and then you really should have not so much a 90-degree angle between your feet and your tibia, the long bone here in your shin, but you really want to have a 90-degree angle between your thigh and lower than your knee. And remember, you don't want your knees to be touching the back or the front of the chair. You want a little bit of space, about 2 inches. The second reason I've chosen this picture is to talk about something called sacral sitting. And I find this really, really commonly in a lot of the low back pain patients that I treat. Is one, their chair is not appropriately sized for them. Either most commonly what I see is the chair depth. It's too deep, so that they're having to get to the proper comfort for them for getting their feet on the floor. They're having to compromise and scoot their hips forward. What that's doing is, what you can see right here, is you're sitting on your pelvis and your coccyx, the lower bones, lower than the sacrum, and you're putting a lot of flexed movement on the trunk, which is straining all these muscles, putting a lot of focal pressure on your bottom and your sacrum, which can potentially over time lead to a blister, or even worse, getting skin breakdown. You really don't want that. Just recently, I had a patient that was a little bit argumentative with me about his chair. He had a nice fancy chair in his room, an armchair, but it wasn't properly sized. It was honestly too deep and too soft. So when I would go see him in his room, he would be sitting in this position, but he'd be complaining of back pain. And then I tried to tried to educate him on Mr. Like your chair is not appropriately sized. Part of the reason why you're having this back pain is because you're sitting too far forward and your pelvis is rotating the way it shouldn't, and you're putting a lot of strain and focal pressure on your bottom and your low back. And you really need to think about ordering a different chair or not sitting in that particular chair. That particular chair was a really expensive chair, so it was meaningful to him, but it wasn't properly providing support. So the point I'm getting at is be conscious, especially when purchasing a new chair. Be conscious of these things, because if you're making a long-term commitment to a seating surface, it needs to be appropriately sized to you, and not just that it looks good or it looks cool or fits well with your decor. It needs to provide adequate support. Um, the third thing I want to talk about is ergonomics. Again, I've just borrowed this picture from Google Images. Proper sitting with activities. This is particularly a problem since everybody post-COVID, I guess you can't really say post-COVID because it's still going on, but since the onset of COVID has been working from home, a lot more low back pain, a lot more problems because of sitting and working at home and working in improper seating positioning, contributing to that pain. So let's talk about the good first. So this person right here, let me blow it up a little bit more so you can see. This person right here has their hips back against the chair as far as possible. Their back is supported. This chair has a little bit of a curvature, so it supports the lower spine better. They're working at a desk. The monitor is a little bit lower, but it's within their eyesight. So they're not having to look down. They're having to look more forward gaze, contributing to less flexed position of the trunk. Their arms are relaxed, their shoulders are relaxed, and they've got probably a 120-degree or so angle here. You really want a 90 to 120 degrees is generally accepted for your elbow, working on the desk lower. Another important thing is the 90-90, what we talked about earlier, where the thigh and the knee are in alignment, creating a right angle. They're perpendicular to each other, and the feet are flat on the floor. This person has high heels on, so that's a consideration as far as bony alignment, but it's still better that their feet are flat on the floor. So what can happen is, as we get tired, as we get fatigued, as we've been working for a long period of time, if what we're working on is lower than our support surface, we end up flexing our trunk forward. And that's doing a couple things. One, it's putting strain on your neck and your musculature to support itself, but it's also putting strain on your low back. And you're more likely to end up with some soreness from muscular tension from having to try to support itself for prolonged periods of time. So it's honestly a little better to be farther back in the chair, a little bit supported, and a little bit, is not exaggerated, but recumbent. Recumbent meaning a little bit leaned back. So the force of gravity acts through your body and allows you to conform better to the chair surface. This lady also, her feet are not flat. She's got her feet flexed. Whatever you do lower in the chain meaning your feet, it ultimately impacts farther up in the chain. So just being conscious. This picture also has a description of something called office syndrome. Just some problems that occur commonly when you're sitting for too long periods of time, or you're working on something and not conscious of your posture. End up with shoulder pain, headache, backache. And that's what we're particularly talking about here. So being conscious of good alignment. So let's review a little bit. When you're thinking about working or sitting for a long period of time, hips back, feet flat on the floor, you want a 90-90, a perpendicular angle from your knees and your shin alignment. You want to be upright, back against the chair, and forward gaze versus looking down. sorry. You really want to be conscious of not sitting for too long a period of time. Stand up every once in a while. Walk around, move, stretch. Sitting is problematic. Our bodies are not naturally designed to be sedentary. We're designed to move. So reviewing this, when you're buying a chair, whether it's a wheelchair or an armchair or an office chair, being conscious of what you're purchasing and does it fit you in particular right? Not necessarily does it look good, but does it fit your body so it's providing enough support to protect your back? So you want your hips as far back in the chair as possible, with your back as much as possible against the chair. You want your knees and your ankles and your shins in alignment, and you want your feet firmly flat on the floor. When you're measuring or when you're going to sit in a chair, even if you don't have a tape measure, you should have a little bit of space in between the back of your knee, the back fold of your knee, and the edge of the chair. This is particularly true with a firmer chair, just so you're not compromising any structures. Seats, I think for me personally, and the people that I've treated, I think seat depth is the most important measurement, or the most important. Because if you end up having a chair that's too deep, you end up in this sacral sitting position, putting a lot of focal pressure on your pelvis, your hips, your low back, and putting a lot of strain on your upper back. Because of gravity and because of muscular fatigue, you ultimately wind up in this position. And people end up getting in this position and end up having pain, which could be a relatively easy modification, just maybe a different seating surface. And all the way reviewing back to the beginning, your spine is made up of your vertebra, and in particular, you've got your sacrum, which is a bunch of vertebrae that are fused, and they interact with the ilium, which is the top bone of the pelvis, to form the sacroiliac joint. This is a very, very common area of pain, just from poor sitting, from poor posture. And then down further low, the coccyx can have pressure because of this poor seating position. And this is very, oops, sorry, I messed up my screen here. Hold on just a second. The coccyx, you can see it here, because it is so superficial to the surface, people end up getting blisters or wounds because they're sitting in the improper position for such a long period of time that the skin ends up wearing away. So that's about it. The purpose of this is just to help some guidelines as far as posture, as far as guidelines for having appropriate seating surfaces in your apartment or home, and just some general information about how to appropriately choose a chair. If you're buying a chair that you want to have in your place, making sure that your hips are back and that your feet can touch the floor, and that you've got a little bit of space in between the back of your knee and the chair surface, just so you're not compromising any nerve structures or vascular structures. Again, my name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village, and this is a continuing series on back care and maintenance. Thank you.